Hi, my name is Joy Lehman, and whenever I'm thinking about justifying a new position, I always like to start with the core mission and vision of the department as well as the mission and vision statements of the organization as a whole. And hopefully those two are closely aligned. But any time that you can tie a request to one of the core values of the department and also show how it's going to move the mission of the department forward, I always find that you have a better chance of success. So I always start there and really think about how is this going to tie in with the departmental goals. The next step, I think, is then to do a thorough gap analysis. The administrator you're presenting to, whether within the department or a higher level organization administrator, are always going to have questions. So it's always good to anticipate those questions. So you have identified what you consider an unmet need, and you want to know why and how are we not meeting those needs currently. What are the financial pieces that we're missing, as well as what are the clinical pieces that we're missing. And then once you have that information, you can answer one of three questions regarding the position, which I feel like administration is always going to ask. The first question is if the position is going to generate revenue. So when I think about our ambulatory clinical pharmacist at Ohio State, many of those positions were justified because they were able to increase prescription volume to our specialty retail pharmacy, which increased revenue as a whole. Other positions were justified because they were able to see and manage follow-up patients for medication monitoring, which opened up time for the physicians to see new and more complex patients, and that increases the physician's RVU. The second question would be, is the position cost saving? So I think about certain positions such as our anticoagulation pharmacist who prevent VTE and have done a tremendous job in reducing rehospitalizations due to thromboembolism. And those positions are cost saving. The third question also could tie into anticoagulation pharmacist and the fact that you want to know, is the position going to improve patient safety or improve outcomes? Many organizations are a part of accountable care organizations or being evaluated routinely by CMS for particular metrics. And so if you're able to show how the position is going to improve patient outcomes, that can tie into one of those metrics. That's also a great way to justify the position. Following that, I feel like it's almost easier sometimes to show benefit, but you also have to be considerate of, is the position going to potentially cause burden elsewhere in the department or elsewhere in the system. So when I talked about before ambulatory pharmacy increasing prescription generation to our retail pharmacy, that may require additional prior authorization coordinators. Or if you're going into an established clinic or you're going to be sharing clinic space, is there ancillary staff available? And it can be even things simple as, is there space available? Will the pharmacist have a desk or an office? Is there exam rooms where pharmacists can see patients? Where is the pharmacist going to see patients? So all of those questions also need to be answered as you do your evaluation and present your justification. As far as positions that I really think that Ohio State needs, there's two in particular which I've noticed for a while and I've really thought about. The first is, of course, pain and palliative, which is a very hot topic as far as the opioid epidemic, but even more granular in our cancer population. As we become much, much better at curing these diseases, oftentimes patients are left with pain after radiation or surgery therapy. Once they're out of their acute phase of treatment, oftentimes the oncologist struggles with managing their pain, and primary care providers are often hesitant to manage patients who have been taking opioids, and so they're left kind of in this void, and we definitely don't have enough pain and palliative physicians or providers, and I think pharmacists are uniquely positioned to help this patient population. So that would be one area that I would see a great need for. The second area is one that I've noticed through my position at Infusion. We see a good deal of patients from our pulmonary and sleep disorders clinic. There are a lot of new medications for asthma as well as COPD and new therapies also for the treatment of sleep disorders. These patients can be incredibly medically complex, and currently we don't have the benefit of a pharmacist to work in a multidisciplinary fashion in that clinic. And oftentimes my operational pharmacists will have questions regarding the clinical management of some of these disease states. And so I really feel that would be a greatly beneficial position, because while our pulmonologists are excellent diagnosticians and as far as and identifying the disease and the initial treatment, they do not have the time or capacity to do in-depth medication therapy management. And I think pharmacists would be greatly utilized in this area to both generate revenue, decrease cost, and also improve outcomes. So those are my two ideas for community-based pharmacy practice. I look forward to hearing yours.